Coverage you can count on. Way 31 News starts now. This is breaking news.
We're interrupting local programming with a news update on the coronavirus. Huntsville and Madison County officials are giving an update. Let's take a listen to what they have to say.
On our community response to COVID-19. Our speakers today will be Dr. Pam Hudson from Crestwood Hospital, Mayor Paul Finley, City of Madison, and Melissa Thompson from the Community Foundation of Greater Huntsville. You will note that we are sitting at least 6 feet apart according to CDC guidelines and our own best practices to sanitize and separate. I'll begin with a brief update of the situation as we know it. Currently, there are 124 confirmed cases statewide. Currently, there are 6 cases confirmed in Madison County. I'll make a comment on that. I know earlier there were 7 reported cases. After the Department of Public Health reviewed the data, they have actually moved 1 case to another county because their standard is based on where the resident lives and maybe not necessarily where they were tested or where they work. So there are 6 confirmed cases in Madison County. We continue to monitor that and respond accordingly. So that's kind of the situation as we know it now. At this point, I'll turn it over to Dr. Pam Hudson from Crestwood Hospital.
Good afternoon. Your community healthcare entities are doing everything they can to prepare for what we hope does not occur, and that includes making certain that we have reviewed and our emergency plans, that we are laying in supplies, trying to be certain that we are ready at whatever time we are needed. Thank you very much for everyone's cooperation with the no visiting policy recently implemented at area hospitals. It is a burden, I know, and we're very appreciative for the cooperation and collaboration we've received from our patients and their families. I would let you know that options for health care include your primary care providers. They have those men and women, physicians and nurses and their staff have worked very hard to stay open, and good news on that front, there is increasing numbers of practices that are standing up a telehealth option, which will allow you to connect with your healthcare provider without actually going to the office. So you might check if you are feeling like you need to connect with your primary care physician. Please do take advantage of that. I believe most offices either started last week or will be fully functioning this week on that. We also have in our community the fever and flu clinic that Huntsville Hospital has stood up, and that is that has been functioning for several days last week. And then there is also a COVID test collection site, John Hunt Park, that was functioning yesterday, I believe. Please do keep in mind that you must have a physician order or advanced practice provider order in order to have the test. Asymptomatic people should not be tested is the guidance that we are getting from the Department of Public Health. So, so if you're symptomatic and you have a doctor's order, that would be appropriate for the John Hunt site, and the fever and flu clinic, they have providers on site that can help you with that. Please help and continue to help prevent community spread. That is our best weapon at this point, and will continue to be our best weapon following the public health orders to flatten the curve. You have a great healthcare system in your community, and we are ready to serve, and you can help us not be overwhelmed with cases. So please, these public health standards are exceedingly important. Wash your hands, practice social distancing, and I would also like to express my, I think all healthcare entities share in this, thanking the physicians and the nurses and other healthcare workers, essential staff for keeping our city and our county operational, first responders who are putting themselves in harm's way often to help us. us. And also, I'd like to express appreciation for the many offers of help that we have had from physicians and nurses who are calling to let us know they're ready if we should need them, and also some of our private citizens who have some special service that they can offer. Thank you very much for continuing to be the great community we have always been here.
Thank you, Dr. Hudson. We'll go to Mayor Paul Finley now.
All right. Thank you, Jeff. And on behalf of Mayor Battle and the Huntsville City Council, Chairman Strong, and the Madison County Commission and our Madison City Council, we have just a couple things to share today. As we move in through the weekend and into Monday, I just wanted to reiterate that both the Huntsville City Hall and Madison City Hall are open for business. We will continue to be there if you need us with any areas that we need to continue to take care of. We do, again, have most of the abilities to take care of things online, and you can also call us via phone. We highly recommend that if you can take it that way, that you please do. Madison will hold our City Council meeting Monday night. It's at 6 o'clock. We, again, highly recommend that you please watch it via Channel 42 or on our website. It is an abbreviated agenda to take care of the very basic things that we need to continue to do. And the only change that we typically would have is there will be no public comments at that meeting. One of the things that did happen yesterday after this discussion was that the Small Business Administration Economic Injury Disaster Loan was approved for all 67 counties in Alabama. You know, there's over 400,000 small businesses that are hugely affected by this and impacted. Additional information will be available on the Chamber of Commerce website for Huntsville, for Madison, and we will also have the information needed to apply for that disaster recovery relief available Monday, or by Monday we'll have that on there. Dr. Hudson talked about how teledoc in the primary care is helping the primary care folks, but it's also minimizing the impact on our emergency rooms, which we so appreciate. I wanted to make sure that everyone knew both Huntsville and Madison have non-emergency numbers for our police departments. Many times folks want information or want to give us information, and I wanted to pass along those two numbers. In Huntsville, the number is 722-7100, and in Madison, that is 722-7190. We've added staffing for both of those. You may have questions or want to pass information along, and it helps us as we move forward to minimize the impact on the police departments. I wanted to say a quick word on the groceries. They're doing a yeoman's job of helping our community, but I also want to talk to our public and our citizens. Guys, it's not a lottery. You know, if you already have what you need, let's hang tight. They have plenty in the system. It's just a matter of how quickly folks went to get it. It takes a little bit of time to restock. So again, if you have what you need, please let others get what they need. Together, we will all get through it in that way. One of the things we talked about before is they call it the Big 10 mayors. The mayors of the 10 largest cities continue to share information. We have a call set up now tomorrow with federal government, again, in the same way of sharing information. They can let us know what they're doing. We, in turn, are able to let them know what we're doing and where we may need some help. And as I end, again, I'm reminding everybody we're making it through this together. We've not seen panic. We've seen a confidence. It's change and is tough for us to get through, and the unknown. And in both instances here, you know, we're along that, and yet this community has done a great job. Continue to wash your hands. Continue to stay socially distanced and have patience. I'll end by saying that everything that we can possibly do is pushed out to the websites of huntsvilleal.gov and madisonal.gov. And with that said, Jeff, I'll hand it back to you.
Thank you, Mayor Finley. Now we'll go to Melissa Thompson, Community Foundation of Greater Huntsville.
Thank you, Jeff. As our community faces this COVID-19 crisis, our nonprofit community is standing on the front lines to provide services and other resources that our community needs, whether it's providing meals for those who no longer have access to those meals, or providing care to our homeless community, which is an incredibly vulnerable population right now. Our nonprofit community is standing ready to help, and every nonprofit, whether they're on the front lines or not, are really affected by this. So some are needing funding to provide additional resources right now, but others are facing a crisis just like our other small businesses, in that they've lost revenue, they've lost ticket income, they've lost other opportunities for donations, they've canceled events, a number of things that are happening that are putting the pinch on them as well. They're wondering how they're going to pay their employees in the same way that other small businesses are. So how can you help? There are 5 things I want to leave with you today. The first is that the Community Foundation recently activated our Emergency Relief Fund. The Emergency Relief Fund is to provide resources to the nonprofit organizations who are on the front lines to support basic needs and health and wellness efforts. We have to date received grant applications from local nonprofit agencies exceeding $100,000 of relief sought. Our resources that have been donated are not even close to covering those needs. If you would be interested in helping, visit our website at communityfoundationhsv.org to make a donation. A second way you can get involved is to donate to your favorite nonprofit organization. As I've mentioned, every nonprofit organization in this community is deeply impacted by this recent situation, and so all need your support. So we want to make sure that whenever our community emerges on the other side of this crisis, that the nonprofit organizations that are supporting us here and now will be there on the other side as well. So your support to them is incredibly helpful. The third way to get involved is our nonprofit organizations need to be connected to one another now more than ever. And the best way for them to do that, especially if they're a social service agency that's providing direct services, is to participate in the Charity Tracker online case management platform. There are over 140 nonprofit organizations currently engaged and active on Charity Tracker. Charity Tracker allows organizations to work together to best meet the needs of those who come to them for services. And so when they can connect the dots, when they can break down the silos between one another, they can better serve their clients. If you're interested, if you're a nonprofit organization, you're not yet on Charity Tracker, I encourage you to visit huntsvilleal.charitytracker.net and then click on the request membership, and the system administrator will get you set up for a free membership. This is free for nonprofit organizations through grant funding. This is a great time to work together to best serve the needs of our community. A fourth way to get involved is to connect with one another through a virtual town hall meeting that has been organized for nonprofit organizations. That will be held on Tuesday, March 24th at 10 a.m. And it's a chance for the organizations to talk to each other about how to best coordinate services for those who they're serving right now, but it's also a chance for them to work through the other complications that they're dealing with, such as staffing, how to keep the lights on, how are you working through keeping your own staff kind of up and running so you can function? How can you work together? So if you want information about how to register for that virtual town hall meeting, visit our Facebook page at facebook.com/CF Huntsville, and there's registration information there. The final thing is, if you're not a nonprofit organization, but you're just an individual and you find yourself in need of assistance, how do you get the help you might need? The best resource is to dial 211. 211 is an active resource in our community. The folks who are on the other end answering those calls can help connect you to the resources that are available in the community. They know what's available, and they know how to help you get to the help that you might need. There are lots of resources in the community right now, but together we really need to kind of work together, break down silos, and really just bring those philanthropic resources to bear. Our community needs us more than ever. Thank you.
Thank you, Ms. Thompson. Thank you for watching today. We will be back on Monday, March 23rd at noon with another daily briefing. Until then, any critical updates will be posted to the City of Huntsville's COVID-19 webpage, as well as the websites of our partners here today. Until then, stay safe, stay separate, and remember to sanitize. At this point, we'll take questions. We do ask when you come to the microphone, identify yourself and who you are affiliated with, and also we will allow one question and a follow-up.
Hi there, I'm Tiffany Lester with WHNT News 19. We were curious about the masks. What is the difference between them to protect, in hospitals, to protect the doctors and nurses and the patients?
That's an excellent question. The question is to tell us a little bit about the different kinds of masks. For a patient who is having a higher risk procedure that might cause aerosolization of secretions, droplets, that would be infective, right now the recommendation is the N95 mask. There are other masks that people have worn and that are nearly as favorable and in much better supply. And those would be a regular, what you refer to and you see on TV, a surgical mask with a plastic face shield. And those are, the CDC has indicated that those are appropriate to use in patients with respiratory illnesses such as COVID-19. So those are the two kind of masks that you're going to hear talked about. There is also, you can get the surgical mask without the eye protection, but that is not appropriate if you're very close to the patient, typically within that 6-foot distance.
When and who should be wearing those masks?
Healthcare workers and anyone else who has to get close to someone who you have a high level of suspicion is potentially infectious. So that would be someone who is reporting symptoms. It is our understanding that the highest infectivity time is when you actually have symptoms of COVID-19 and not necessarily with asymptomatic individuals. So for the healthcare workers, the challenge is you don't really know who has the symptoms until they tell you. And so that's why we have initiated the screening outside of the emergency departments, asking those questions, identifying people who may be at risk, understanding what their symptoms are, and then if they are in that infective period, at least the best information that we have now in that infective period, to separate them immediately, not let them go and sit next to somebody else in the waiting room. So the precautions that we're taking. So then and when that happens, we'll put a mask on the patient. So masks can be used, and that would be just the regular surgical mask, to try to reduce the spread of droplets. So when you see people wearing masks out and about, I always assume they think that they are infective and make sure that I maintain my 6-foot distance.
I'm Casey Albritton with Way 31 News. I do have a question about the drive-through with the COVID-19 testing. I know that 400 of those tests were donated. What happens when those 400 tests they run out? What happens next to get more of those?
That is an ongoing process to secure test kits. The Alabama Department of Public Health has been supplying healthcare entities for the last several weeks. Last night on their website they posted that they don't have any more. Now we hope that they will get some soon. But there are other private industry companies that are stepping up, and I would expect in the next few weeks we will see a much higher availability of the testing, or the test kit availability. Most hospitals are trying to hold on to those to be able to test inpatients, people who are highly symptomatic, and a lot of those tests are going to drive how we take care of the patient, how careful we need to be using those personal protective supplies that we believe will eventually be in short supply. But right now we're trying to have as many and as much as we can get our hands on.
Okay, one more follow-up question for you. We know right now that the drive-through clinics are not open on the weekends. Can you reiterate where people can go to possibly get tested? Well,
thanks for that question. Here is the first rule, if you will. Asymptomatic people do not need to be tested. We have had some reports of people who want to be tested because their job sent them home, and while very sympathetic to that, that's not the best public health use of a test. The other is that the test should be administered to people who are at risk. And that at-risk conversation happens between the patient and the healthcare provider, whether it's a physician in their private office, whether it is a nurse practitioner in their clinic, whether it is through a fever and flu clinic such as we have. But that is the population going through those CDC test questions. Have you traveled? Have you been exposed? And what, what your symptoms are. So those are the people that would be perhaps feel like they needed to be tested on the weekend. Keep in mind that the test doesn't fix anything. And once the test is done, no one right now that I'm aware of in our community is able to turn a test around in an hour, for example. I believe we will get to that point in the near future, but right now that hasn't happened. So you're going to be told after you have the test to go home and isolate. Pretend you're positive until you hear differently. So there really isn't an emergency to be tested, so I would encourage people to utilize the resources that are out there during the regular time frame. If, on the other hand, you are sick, we have 2-3 excellent emergency departments in our county. They are there to help, but again, that shouldn't be used as a, gee, I'd like to know, or I'm a little bit sick. Normally I wouldn't go seek advice, but gee, I'll go to the emergency room. So everybody's done a great job with that, so we're very appreciative that people have been self-selecting.
Thank you.
At this point, we will conclude our press conference. Again, we will be back here again on Monday, March 23rd at 11 a.m. Thank you for coming.
All right, you're just hearing from city leaders from Madison and Huntsville. To reiterate some things, 124 cases of coronavirus have been confirmed in Alabama, 6 of those cases in Madison County. It was 7, but after further review, officials have moved a case to a different county. The cases are based off where that person lives, not where they are tested. There will be another briefing on Monday. Right now, we're going to send it, though, to an ABC special report over in the White House. Let's take a listen to that.